Hi guys, welcome to the Aurora AKT 30-day challenge. I'm Dr. Aman Arora from Aurora Medical Education. Throughout the next 30 days, we're going to throw you 30 different questions to get you thinking, building up knowledge, thinking about technique, and boosting your confidence before your AKT exam. Now, I remember when I had 30 days left before my own AKT exam, I was super stressed. It suddenly dawned on me just how much material there is, and all the doubts started to creep in. How am I going to remember all of this? What if I don't pass this exam? How much is it going to take out of me? How am I going to do it with all of my normal day-to-day work-based activities, portfolio, on calls? All these things started to build up around this time. So the reason we're starting now is that for the next 30 days, day by day, I'm going to go through a question with you and start to build up knowledge, but also confidence and also technique. Because those three things I think are really important to try and make sure you get the maximum you can from your potential in this AKT exam. So every single day I'll come at you with a question. We'll have 57 seconds to do that question on screen, just like you'll get in the exam. It's around about that time that you'll get if you divide the number of questions by the time that you get. So it puts you in that pressure framework. Don't worry if you get the question right or wrong. It's not about how many you get out of these 30 questions. It's about what do you learn from them from a knowledge point of view, but also a technique point of view, and how much can we boost your confidence day to day. So I'm with you for the next 30 days. Stick with me. Come and join me every day on whichever social media channel you're following this on. Join us every single day and let us boost your confidence ready for AKT. So I'm going to switch to the next slide. I'm going to go silent for 57 seconds, have a think, try and work through the question, pay attention to both knowledge and to technique. And then we'll come back on the other side, give you the right answer, but also teach you a whole load of things that are going to take your preparation on that subject to the next level. So let's go, 57 seconds, let's begin. Okay, guys, that is time, 57 seconds. Please do think of an answer, even if you haven't got one just yet. Hopefully you've come up with something. You can see how quickly time goes when you're in a bit of pressure. Now, of course, not every question is going to have to be answered in 57 seconds. You're going to be answering some much quicker than that, and some are going to need a little bit longer. But we're just looking at an average here just to give you an idea about how quickly you need to think about things. Right, so question one then, the answer is D. So well done if you got D as the answer. If suspecting age-related macular degeneration, he should be seen by ophthalmology within 1 month. That is the correct answer because that is the least correct statement. Now, eye conditions, eye problems, we see a lot of those in primary care, is an area that people struggle with. So it's really important to get this right. Now, let's look at this from a teaching point of view as well as a technique point of view as well. So let's go through the question. A 67-year-old male presents to you with a gradual deterioration in vision. So gradual as opposed to acute. That should get you thinking in different ways already. The age already should have acknowledged something in your mind out here because it can take you different directions. He hasn't seen an optician yet. There are no other eye or systemic symptoms. Very important because there are no other cues or clues that could take you down certain routes in terms of a diagnosis. Which of the below statements are least correct with regards to common possible causes? Now, the first technique thing here is this double word least correct. Now, just put a comment down below, whichever stream you're watching this on, if you didn't see that word least, and if you just read it super fast and saw the word correct and went straight into the answers, found a correct statement and thought that is the correct answer. If that was you, don't worry. It happens to a lot of people. We do lots of teaching on AKT and technique-based things, and this is a very common error. Because we're reading so fast, we either miss these little words in the question or we miss little words in the answer as well. So if you didn't see that word least, make a note of that. It's something that can happen again and again, and it can lose you lots of marks, not because you don't know what you're doing, but because of a technique issue. So which of the first is least correct? Now, when you see a double word like this, one of the most common things we talk about from a technique point of view is changing two words to single. Now, even if you spot least correct, as you start going down the statements A, B, C, D, and E, it can get quite stressful. You're looking for the least correct, least correct, least correct. By the time you get down to the D, you're thinking, is it least correct or correct? And it can get very stressful, and you have to go back up again and correlate what you're doing. So one of the most common things that we say from a technique point of view is change least correct to a single word. Basically make that statement, which of the below statements is false. False, false, false. I'm looking for false, not least correct, because A is one thing to pick up the word least, but then B, it's about making your brain register that you're looking for a false statement. It's much easier to go down from A to E thinking which is false rather than which is least correct. Right, so the false statement, D, if suspecting age-related macular degeneration, he should be seen by ophthalmology within 1 month. Why is that false? Because the guidance says, NICE suggests within 1 week. Now, with age-related macular degeneration, of course, there are two types, wet and dry. You can't clinically differentiate the difference. The one that you worry about is wet, and therefore they say you need to be referred and seen within 1 week by ophthalmology. So that is an incorrect statement. And that's why D is the correct answer. All the other statements are correct. A, not everyone with age-related macular degeneration will have symptoms. That's a true statement. Some people with mild and maybe even medium, intermediate age-related macular degeneration don't have symptoms, and it's picked up just through examination. So that's a true statement. B, if you suspect a cataract, he need not always be referred for the consideration of surgery. This is a true statement. Now, you might read this really quickly and think about cataract, referral, consideration, surgery, true. But the second bit of technique teaching here is the word always. That's a very, very hard word. What this statement suggests is that if you suspect cataract, it doesn't matter what stage, doesn't matter how much impact it's having on that patient, we should always refer for consideration of surgery. Now, that's really important. Any kind of hard word that you see, always or never, you've got to kind of subconsciously start picking that up as unlikely to be true, because very little is 100% in medicine. And hard words make a big, big difference. So that's a true statement. He need not always be referred for consideration of surgery. See how complicated it can get. C, the presence of silver wiring on examination indicates the need to check his blood pressure. Absolutely right. Hypertensive retinopathy, one of the classic features is silver wiring. Of course, you have diabetic retinopathy and hypertensive retinopathy. Really important to make sure you don't get those two confused. D, like we mentioned, is the correct answer because it's an incorrect statement, but E is also a true answer. A history of trauma may be a risk factor for developing a cataract. And again, another bit of technique thing here is may. Now, we've talked about hard words, always and never, and the fact that they're not, you got to kind of subconsciously think that, hold on, that's unlikely to be true. But when you start seeing soft words like may or can or sometimes, you've got to kind of subconsciously start thinking, okay, they're higher likelihood of being true, because even if something happens 1 in a million, it may well happen. So when you start to differentiate hard versus soft words, you start to be able to pick up little cues and clues in the question, even though you may not know the full extent of the medicine that you're dealing with. So a history of trauma, I mean, trauma is a classic risk factor for developing a cataract. And when you go back through a history of someone, you ask about eye trauma, that should be something that you think about, or something that you should spot in a question if they mention it in the actual stem itself. So well done if you got D. Couple of technique things already on day one. Make sure you don't miss words in the question because you're reading so fast. It's easy to miss that word least. Number 2, change double words to a single word. Change least correct to false in your mind. Remember, it's unlikely to be asked of you as which is false, but you've got to change it into your mind to think like that. Number 3, hard words versus soft words. If you see a hard word, subconsciously think it's unlikely to be true because very little is 100% in medicine. Whereas if you see a soft word, always think, okay, even if it's 1 in a million, that could be a true statement, and it might swing you in terms of how you choose one answer to another. And then, of course, you've got to team it up with knowledge because you've got to know that silver wiring and blood pressure. You've got to know the guidance in terms of referral for macular degeneration, etc. So you've got to tie this balance between knowledge and technique. And when it comes to AKT, if you don't work on both of those, you've seen already in one question how it can make a big difference. So if you didn't get that right, or if you did, put some comments down below. Let us know how you did with that question. And tell me if you learned something new there about technique that you hadn't thought about before. So a few key pointers about chronic eye conditions then just before we end day one. So I've focused on macular degeneration and cataract because they came up in the question and they're things that we may well see in primary care and therefore may well get in primary care based exams. So macular degeneration, then age-related changes to the central retina or the macular area. You have these two types like we mentioned, wet versus dry. You can't differentiate them clinically and that's why they should be seen within 1 week by ophthalmology to make that differentiation so you're not missing the wet version. And how is it going to present? Central vision is affected because it's your macular area that's being affected. So, for example, the story might say they have trouble reading a newspaper. They're looking at a newspaper, but the bit they're looking at, they can't really focus on, but they may be able to read the bits around it. For example, straight lines might start to appear wonky. And on examination, you have those classic drusen at the back that you might see on fundoscopy. So there's kind of lipid protein collections that build up. So if you see drusen in a question, make sure you think about macular degeneration. And please remember that referral. Cataract, on the other hand, a cloudy area on the lens, so ultimately reduces transparency. Most cataracts, of course, are age-related, but they can be secondary to other things. You can have them congenitally, but it can be secondary to trauma, like we mentioned in answer E, and also systemic diseases like diabetes, for example. So look out for things in the question that make you think cataract because of risk factors. Also, including other conditions, think about things like steroid use, for example. Smoking is another risk factor when it comes to cataracts. And then the guidance in terms of management depends on whether it's an adult or whether it's a child. So if it's an adult, we should be advising first and foremost an optometry assessment if they haven't had one already, and we can consider surgery in certain situations. Remember, we shouldn't always refer for consideration of surgery. It's got to be based on things like how the visual acuity is affecting someone's life, things like comorbidities, is it leading to falls, for example, what's the risk of other things happening, and do they have other eye conditions that may benefit from treating a cataract. So all these kind of things need to be borne in mind, which is why you wouldn't always do a referral. But children and babies, like I mentioned, it's very different. So urgent ophthalmology referral if you get a question about a child or a baby and you notice a cataract there, a congenital one, for example, that you might have noticed. So question 1, day 30, hopefully that's giving you a good starting point. Every single day we'll be doing a question like this where we'll pause for 57 seconds. We'll get you to think about things from a knowledge and a technique point of view, and then we'll do a little bit of teaching on the other side about that condition. We'll be covering clinical, we'll be covering stats, and we'll be covering admin as well. Please do put a comment down below wherever you're watching this, YouTube, Instagram, Facebook, LinkedIn, wherever you're watching this, just to say, was this helpful? Are you going to be coming back for day 29 tomorrow? Please do share this with other people if they don't know about this so they can benefit as well. Another quick point to remind you just before we leave about Aurora Daily. I know a lot of you guys use these already. Every day at 7 p.m. we send a free teaching email based around a really quick clinical question. So for example, a question like this about folic acid, this comes into your email box for free at 7 p.m. and you just click this little video and it gives you a really super quick teaching bite based on a guideline, an investigation, or a treatment that's very, very topical for AKT. So you just head to the website, there's a bar at the top which says join Aurora Daily. You click on it, you put your email address in, and you'll start getting those emails every single day for free. Let us try and teach you on that basis, as well as let us see you tomorrow on day 29. Now the hashtag camp as will pass, hashtag I went with Aurora. See you tomorrow.